That it's gone this far speaks to Italy's desperation to contain the virus.
The struggle could soon be over. Thanks.
The country continued to drop. As the last patients left, many expressed their gratitude to the men and women who put their health on the line to save other people's lives.
It's hard to say goodbye. We built an emotional bond between us. I promised them that if they come to Wuhan again, I'll take them to try our local delicacies.
The decision to close most of the hospitals in Hubei province comes after China reported just 40 new cases of coronavirus nationwide on Monday. That's the lowest daily increase since the outbreak began in January.
The epidemic and prevention control situation continues to work well. All provinces except Hubei have been seeing single-digit new confirmed cases since February 27th. And on March 7th and 8th, there was 0 new confirmed cases in those provinces.
Last week, a senior official hinted that authorities could soon lift travel restrictions on Hubei province. The lockdown, which began on January 20,
relates to flavors. So the recommendations are in 3 main areas. The first is to the federal government, who are responsible for the manufacturing of the ingredients.
And I will ask the kids right there, how many of you have tried vaping? 80% of the hands go up. And then I would go a step further and ask, how many of you vaped yesterday? Just, to put it in perspective, is it something? And over half of the hands go up. We could, I think, be...
And Mayor John Tory in the fight to keep public health an integral part of the Ontario healthcare system. Jane Greer is here from there, and the Birth Control and Sexual Health Centre.
Great. And just for the benefit of members of the committee, IWHC stands for?
Formerly known as the Immigrant Women's Health Centre. We chose to change our name as we know that the need for sexual health testing for men is as critical as it is for women, and especially we offer language to be able to come to our clinic and get counseling and testing.
And speaking on behalf of a number of organizations, because you all receive funding for sexual health programs and services.
That is correct. We are funded, all of our 3 clinics are funded by Toronto Public Health. So we are integrated into the public health system, but we're not actually public health clinics.
And continue to receive funding on a go-forward basis.
That is correct. We serve a large number of vulnerable communities and peoples through our clinic work. We offer a lot of access in terms of extra hours that are not available through some of the public health clinics. And so we feel very strongly, and people in our community as well, access these services quite regularly, which is shown through the higher numbers of positive STIs that we see through our clinic work. So we feel that this funding needs to be maintained, as well as the funding for all sexual health clinics that are in the sexual health clinic program.